The following speaker will be Professor Dr. Rohaizat Baharun. He was an exchange scholar and guest lecturer to a plethora of both international and local institutes and universities. He has taught various graduate and undergraduate courses and supervised both master and PhD research students. Until now, he already graduated 25 PhD students, in which 3 of them got the Best PhD award. He actively participates in various international conferences and won a few Best Paper awards. He also organized and facilitated in industrial management training and development and became an editor for a few international journals. Besides, he also became a visiting professor for local and international universities and had published about 10 books with well-known publishers such as McGraw-Hill, Pearson, and Lambert. Dr. Rohaizat also successfully commercialized 2 brands of FMCG, which were marketed in Malaysia market. Now, Dr. Rohaizat is going to talk about branding professional services by innovative approach.
Okay, thank you very much, Chairwoman. Okay, let's get this. Okay. Okay, I'd like to share with you one of my research about branding professional service. Okay, maybe the first speaker, second speaker already talked about a little bit about brandings, but now I would like to talk about the professional service. What you mean by professional service is the doctor, lawyers, architects, pharmacists, engineers. Okay, because okay, they cannot advertise their product, their services in the mass medias. Okay, so that today agenda will consist of the introductions, then I will talk our studies and our methods, then we talk about findings, and the last one is our conclusions and recommendations. Okay, as we know that our research is on the case studies, because professional service, there are so many professional service, so that we are focused on healthcare service. Okay, as we know, as Malaysia and other countries, there is a law and regulation about every professionals. Okay, in medicals, there is a few act. Okay, so that this act prevents the medical services, doctor, clinics, pharmacies to promote their services. So that our concern is how they want to promote their services, their service to the client, to the customer, because the regulation, the law prevent them, okay, from the advertise the services to the client and the customers. Okay, for your information, in Malaysia there is two main major law prevent them to the to promote their services. First is the Medicine Advertising and Sale Act 1966, and the second, as you know, if you see this act prohibits all the advertisements from their services, except the federal and the state governments. They, in our mind, in their minds, how they want to market their property service to the clients, because these acts and other acts also prevent them from the advertise their products or their services to the open market, to the mass media, because they cannot, okay, advertise or promote their services and product that they provide to the customers in the newspapers, in the magazine, in the TV or radios. So that this is the scenarios. Okay, then this is trigger us. Okay, what is the strategy? Then they can implement to to market their products to the client and customer without breaking the laws or the acts. So that from our reading, from our talking to this professional, so that we come out with one hypothesis. Because in Malaysia, as the law in the Malaysia, allow governments and the state government and the federal government. For example, I give you these examples. Okay, they have apps in for the COVID to trace all the COVID patients, and also the program that for vaccinations. Okay, this is a law in the law for the government, the federal government and the state governments. Okay, for our studies. Okay, we want to know, because we predict that, or we from our research that we found that branding can help all these professionals to market their products to the client and the customers. So that we want to know, okay, what is the branding in healthcare and what is the dimension. If the branding is one of the solution to market the products, what is the dimension that's contributed to finance and marketing performance, all these, okay, healthcare services. Okay, that the method that we use, we interviews all the owners and the managers of the medical clinics, the pharmacy, dental clinics, and maternity centers. Okay, that the area that we focus is Iskandar, Malaysia Township, or Nusa Jaya at Johor Bahru, one of the southern state in Malaysia, because it's a new town areas. So everybody come there. Okay, all the professionals also go there, so that we want to know what is the methods. What happened is this. Okay, we use both quality and quantitative. Okay, for the respondent, for the qualitative, we interview about 5 professionals, the owner and the manager of this healthcare, and also we done also the quantitative. We go to face-to-face, talk to them about all this branding strategy in their outlets. Okay, for the findings, we find that some we use, okay, in the finding. First, we use brand trust. Okay, second, we use brand quality elements. And the third one, we use brand orientation. Okay, brand trust means we are measure how much confidence of customer have in your business. So that how much they trust the professional service outlets. In the brand equity, we want to know determined by customer perception and experience with the brand, because they come to outlets or healthcare so that they know about what they expect and what is experience after they receive the services by this healthcare service. And the third item we use is brand orientation. It's a management philosophy that places the brand in the heart of organization decision-making process. So that whether they are consider this when they are when they have any decision process in their how to increase their performance in their services. Okay, so that in the qualitative service, when we interview them, okay, 2 out of 5 knows that the meaning of brand and how to measure the brand dimensions. However, majorities don't know about the brand image and the brand values, how to increase the brand image and what value you plan in for your brands. Okay, 1 out of 5 use marketing approach to create a good brands. This is only 20% of them use marketing approach to create a good brands. Okay, and 4 out of 5 know the brand trust. This is more encouraging. They know about the brand trust. Okay, how to make people trust of the organization, how to make, because when they know when the people know, the customer know about the brand trust, so that they create the competitive advantage, they credibilities, and that create the credibility of their outlets or their services. Okay, go to the quantitative when we interview face to face to the managers, to the doctors, to the the owner of the healthcare. We found that the brand trust is not important. Okay, we'll talk later on what is it, because they don't know about they don't know about the how. Okay, the people trust their brands. Okay, and our findings also state that brand orientation affects their performance. Okay, how they make decision process. Okay, towards their outlet services, so that affect the performance of the companies or the healthcare centers. Okay, the third one is also we know that brand equities, okay, the perceptions, okay, the awareness of the people affects their performance. Okay, and the last one, technology and medical innovation not affects the performance of their outlets. Okay, what is the conclusions? Okay, because it's a new townships, okay, people keep coming. Okay, they recently opened about 10 years ago, and they also coming to that townships. So they need a brand trust need take times. Okay, in order to the people to trust to the company, in order to the people to trust the outlet of their services and brand, they take time. So that happens okay very fast. Maybe take 3 years or 4 years. In management theories, if you learn S curve, it take about 3 to 5 years. Okay, to company to be stable in their business. So that same with the brand trust. So that it takes time to the customer or the client to trust them as a healthcare providers. Okay. The second one is that we need to put the brand equity or brand orientation is the mindset of the owners, because they don't really put this one of the important thing when they make decision process, to increase their sales or to increase their outlets, or to make brand image, their reputations, so that they need to have a brand equity and brand orientation as a knowledge, for them to make decision process. And the last one is the introducing new innovations, not to increase sales, but for brand image. No majority of this healthcare, when they introduce a new innovation, new knowledge, new methods, new apparatus or new devices into their centers, they think about, when we invest all these things, we can increase our fees to our customers. This is the old thinking. So that when they are buy or purchase a new product, a new technology, introduce a new methods into their healthcare centers, so that this introduction must have in their mind to increase the brand image of their companies, not to increase, because when customers and clients okay, know about this. Okay, because of this, they increase the brand values of these companies so that customer willingly to pay more when they accepts the brand values, okay, for the companies. So that if you, okay, so in a conclusion and implementation, okay, we must use innovative activities and element to create brand values. Okay? And the second one, brand activities need to be included in the company, okay, in the strategic planning. So that anything that we do in the strategic planning of the company, we must think of the brand activities or brand elements. Okay. And communication must be do in and outside the organization is a bit for success is meant because the communication inside for the nurses, for the workers and outside, okay, for the client and the customer must be a two-way communication so that then the staff also, not only the managers, okay, the doctors, the engineers, okay, know about their strategies, but all the workers must know all the strategies. Okay, the last one is brand equity is responsibility for every organization, not only the owner, not only the manager, everybody who work in the organization must have the mindset about the brand equity or the brand elements. Okay. For your information, if you want to know further about these articles, okay, you can go to, because of these articles, this article was already published 2 years ago in one of the high impact journals. Okay, you can go to this article for further readings. Thank you very much.
Thank you, Professor Dr. Rohaizat Baharun. I believe that your speech has inspired every one of us, and I'm positive that we will carry out some of your important topics in our future.